My name is Drew Klein. I am a board-certified sexologist, and I am the president and clinic director of FocusWave Clinic. Welcome to the Sexologist Office. So what is Peyronie's disease? Peyronie's disease is a very common condition. It affects about 10 to 12% of men over the course of their lifetimes, and it's characterized by a few things: curvature of the penis, a painful erection, some hourglass shaping of the penis. It's a very, very traumatic condition, and I'll explain to you a little bit more about the etiology and the treatment protocol for Peyronie's disease, neither of which is really well understood. So the etiology of Peyronie's disease, how does it happen? In my experience, dealing with thousands of PD patients, about 1/4 of men, 1 in every 4 men, know exactly how they injured their penis. Either it was during rough sex, or rough masturbation, or they got a puck in the dick, or they snapped a branch off on the head of their cock. They're very aware of how and when this all started. About 3/4 of men do not know how it happened. They woke up one day, it was curved, it was painful, it was a different shape, and it's very, very traumatizing to a lot of men. Either way, it's traumatizing to men. Believe me, there's a psychogenic component to Peyronie's disease. While it is a physical fibrotic anomaly, it's very clear that it's not a confluence of factors like erectile dysfunction. It's strictly a physical and fibrotic anomaly of the penis, a plaque that builds up in the tunica albuginea. But the psychogenic component for Peyronie's disease is really, really critical. There was a recent study that was just completed, just finished in July 2025. It was a 25-year cohort study that showed that men who have Peyronie's disease have a much higher prevalence of depression and anxiety than those who do not. And you are also at a much higher risk of depression and anxiety if you have Peyronie's disease than if you do not. It's a very significant and a clear landmark study on the psychogenic effect of Peyronie's disease. So men, you have to do something about it, okay? How it happened is not as important as fixing it or trying to fix it. It is a disease, and if not properly treated, it can lead to erectile dysfunction. So out of the 3/4 of men who don't know how it happened, in my experience, this is what I believe is the cause of Peyronie's disease: nocturnal penile tumescence, which is what every healthy man who has normal erectile function gets, 3 to 5 erections every single night. So if you can imagine, you're having erections during your dreams while you're asleep. All it takes is turning over on your penis the wrong way can cause major, major problems, including, I believe, Peyronie's disease. Also, I've noticed as well, patients who are post-surgery tend to come into our clinic and say, I had surgery on my kidneys, on my bladder, it doesn't matter, and they walked out of there with Peyronie's disease. A misplaced catheter, misplaced or misremoved or roughly handled catheter in the penis, I believe is enough trauma to cause Peyronie's disease. Worth mentioning.